This is Dr. Christopher Sendy with Nova Health Recovery Ketamine Infusion Center, and I'm going to discuss ketamine therapies for chronic regional pain syndrome, CRPS, and general neuropathies. Now, the diagnosis of CRPS is fairly involved, but there are specific criteria for it, and it's a horrible neuropathic condition that affects a number of different systems and has a number of different characteristics. But for those that are diagnosed with this particular condition or other neuropathies, there are some similar etiologies for this. Now, pain obviously is a necessary thing for us to all experience because if we injure an extremity, we need to basically protect that extremity, for example. But once the healing is done and there's still pain involved, then basically pain serves no purpose. And so neuropathic pain results from lesions of the somatosensory nervous system causing alterations in structure and function. And basically what happens is you get pain that occurs spontaneously, and responses to noxious and innocuous stimuli are amplified. So basically all pain and all stimuli begin to feel very uncomfortable. And chronic pain is what occurs when an injury is no longer present, but key areas of the brain still perceive physical discomfort. And this could be the result ultimately of peripheral and central sensitization. And so there are actually alterations in specific receptors in the brain and the peripheral nervous system, in particular the NMDA receptors and glutamate signaling that can result in increased pain. And this is the NMDA receptor down here in the left in its inactive state. There's a magnesium ion in the channel. And basically, this particular receptor is involved with sodium and calcium ion flow when it opens up. And this calcium that flows in allows for protein machinery to be turned on. And excessive opening of the NMDA receptor can result in excitotoxicity and neurotoxicity, damage to neurons. And the effects of changes in NMDA receptor functioning alters quite a few different features of our physiology, including pain and mood and depression. So basically, as a brief review, we have neurons which connect with the presynaptic neuron from which a signal comes and the postsynaptic neuron to which a signal goes. And on the neurons endings that I'm pointing to right here, the synapses, you'll have these receptors and these NMDA receptors and AMPA receptors, both of which are glutamate sensitive. And basically what happens is when glutamate gets released from the presynaptic neuron and gets into the synaptic cleft, it interacts with AMPA receptors primarily first and somewhat with NMDA receptors. And it actually opens up the AMPA receptors, causing a depolarization of the postsynaptic neuron, and then this allows this magnesium ion to get expelled from the NMDA receptor, and then it allows it to open up, allowing for sodium and calcium to enter through. Now, there's a binding site over here for both glycine and glutamate, and so basically you have to have both bind in order to open up this NMDA receptor. And this is important because it allows machinery inside the neuron to be turned on so that you can get neuroplasticity, for example, the formation of new dendrites and connections. And so it is certainly an important feature. NMDA receptors function in the perception of pain as well as in mood and a number of other parameters in the brain. So chronic pain and CRPS evolve through some complex mechanisms. And basically, as we mentioned, the NMDA receptor is present throughout the central and peripheral nervous systems. But upregulation of the NMDA receptors such that there's more of them and they get phosphorylated, which makes them more active and they stay open longer. And with increased activation of these receptors results basically in increased release of specific mediators of pain, for example, such as substance P in the spinal cord, so that we start to feel more pain. And there's also changes in synaptic plasticity, which occurs centrally and peripherally, so that we start to rewire the machinery for which we feel and sense pain. And the brain can also decrease pain signals coming in from the periphery, but in chronic pain, our ability to inhibit these signals from coming in, the downward inhibition of these signals basically decreases. So all the pain signals, all sensations that are horrible come towards the brain and we feel everything and it's amplified. And then there's also inflammation as well. inflammatory immune cells increase in the central nervous system and in the peripheral nervous system, and this increases pain as well. So how ketamine works to decrease pain in these cases is by influencing the descending pathways, the descending inhibitory pathways, so they work better, so you perceive less pain. But ketamine also has anti-inflammatory neuroprotective effects as well. And ketamine acts and interacts with opioids when you're treated with opioids additively or synergistically. And also this increases the descending inhibition of the pain so that it doesn't come up and we don't perceive it as much. And also ketamine prevents opioid hyperalgesia. So chronic pain results in increased sensitivity to pain, and this is due to changes, as we mentioned, in the NMDA receptors function, structure, and number in both central and peripheral areas. And ketamine can block NMDA receptors. And as a result of that, it can alter the way that the neuroplasticity happens and the connections so that the functional connectivity that otherwise would cause chronic pain gets altered so that we don't feel the pain as we did before. And so there are, again, as I mentioned, there are changes in functional connectivity in pain networks due to chronic pain. And we get a more normal state of functioning through neuroplasticity with ketamine therapy. Ketamine also reduces the release of substance P, and substance P, as we mentioned, causes pain. And also there's a decrease in neuroinflammation, as well as alterations and improvement of the aberrant glutamate signaling that occurs in chronic pain states so that we promote appropriate synaptic plasticity. So ketamine therapy for CRPS has been evaluated in several studies, and these studies are basically a combination of certain types of controlled trials, case series, and of varying amounts of ketamine over varying times and under varying circumstances. So the evidence of how ketamine should be used and is used is really all over the place based on the studies. But basically the effects are that ketamine seems to have a positive impact on CRPS and neuropathic conditions, especially when it's used in higher doses for longer periods of time. But the total number of patients that are in these trials is not large, and mainly because the protocols are extremely rigorous. And so when you look at some of these studies that are on this page here, there are basically a number of outpatient and inpatient protocols that have been used for ketamine therapies, and some of them involve super high doses for multiple days, as much as 10 days, and others are more for outpatient treatment, such as the one by Schwartzman, where they used 4-day treatments for patients with CRPS and evaluated patient outcomes from that. And so effectively, when you kind of sum up all the options of treatment, the majority of the evidence is really just what's happening in the clinics and what the clinics have actually been able to find out about how prolonged ketamine infusions seem to really be helpful for CRPS. And it's a lot harder to put on a percentage of improvement in individuals who have CRPS and get ketamine infusions. I mean, there are some people that don't improve, and so obviously they spend a lot of time in the clinic. They also spend a lot of money. And as far as the side effects, which we'll discuss shortly, obviously there are some as well that are just transitional when the person's getting the infusions. But basically, the majority of centers are using 5-day infusions initially when a person comes and they're diagnosed with CRPS. And these are high doses of escalating ketamine, and it impacts the NMDA receptor activity and alters pain connectivity. And the goal behind these multi-day infusions is basically to overwhelm the NMDA receptors and decrease the central sense of pain, as well as basically altering the functioning of these NMDA receptors to decrease pain ultimately. Now, inpatient CRPS treatment options exist, but it's difficult to find centers to do this. And these are like multi-day infusions, and they are, again, in varying degrees of lower doses, moderate and higher doses of ketamine. Different centers have different protocols. But again, the studies continue on in regards to treatment of CRPS. One thing that is apparent, though, is higher doses for longer periods of time certainly work very well. Again, it's that 5-day initial series that is really what kind of kickstarts the whole process. And the doses that are used are anywhere from zero point 0.3 milligram per kilogram per hour to over 1 milligram per kilogram per hour. And sometimes they will just push the maximal tolerated doses to try to achieve the best responses. There are some cases where a gram is used in over 4 hours over the 5-day series. So each day the person gets a gram of ketamine. And of course, that's quite rigorous infusion. But that said, individuals can be made quite comfortable with appropriate sedation. And again, the treatment is quite safe. The main side effects are, of course, nausea. And so, discussing side effects, one issue is always the concern over neurocognitive functioning. And this has been shown to actually remain normal. So, after the infusions are done, there's no issues with your cognitive abilities. So, it has been found based on studies to stay stable, that there's no negative change. And mood is also generally not impacted. So, if you're depressed, it doesn't make you any happier because the doses are so high. And one thing is liver function tests can certainly be monitored for elevation because at super high doses, you can get liver function elevations that go back to normal when you stop the ketamine infusions. Bladder symptoms are rare. People discuss interstitial cystitis frequently. It is something which is discussed in literature from ketamine abusers, but it's not frequently seen in clinical settings. And during the infusions, obviously, you're going to have psychomimetic effects. You're going to have these hallucinations and hear sounds and be a little bit disoriented. Sedation is really critical during these infusions, whether it's Ativan, Versed, or some other sedation. And of course, antiemetics, because nausea and vomiting and dizziness, kind of vertigo feelings are very common. And of course, dissociation and coordination issues are common as well. But again, they resolve shortly after the infusion is stopped. So the experience of these types of high dose infusions is multiple hours of just kind of being kind of in that deeper semi-dissociated state. But again, this could be completely relieved with appropriate sedation. And of course, there's always the concern of misuse and abuse can occur, but there's no true withdrawal effect from ketamine. And so, used in the clinic setting, this is extremely monitored and extremely safe. So, aftercare from these CRPS infusions is really important as well, because once you get to the initial series, you're going to need follow-up because this is a treatment, not a cure. And although some people can be put into remission for their chronic regional pain syndrome or their neuropathy, the fact is that you will need probably a follow-up infusion every 3 to 4 weeks initially. And of course, trying to space them out further and further is great. At Nova Health, we use home-based ketamine nasal spray and lozenges to help maintain the efficacy, and it's certainly very helpful for individuals with a lot of allodynia or just bizarre types of pain. And also dextromethorphan can be useful in maintaining the effectiveness of ketamine in that first month. It's been found to be pro-cognitive as well as decreasing return of pain. And you still want to have physical therapy and other interventions to be maintained. You want to continue mobility and eating an anti-inflammatory diet. And just remember, this is a treatment, not a cure. So 60% of patients will have improvement of symptoms. The one thing that might be mentioned is a lot of times that insurance won't cover this treatment because it is off-label. And even though it is technically pain management and improving quality of life indicators, unfortunately, insurance frequently doesn't cover this in outpatient settings. So the summary of pain therapy with ketamine, especially for CRPS and the deep neuropathies, is that basically the data is more clinical in nature for the use of ketamine in pain management. And the study trials are scattered in their methods of ketamine used in the patient populations. Most of the patients had multiple types of pain, and the areas involved were different, and also the dosing structures, escalating doses, static doses, super high doses were all used on these individuals. And so it's very difficult to congeal all the information into a nice, succinct type of procedural flow for patients with pain and CRPS. But we know that ketamine infusions are definitely more effective for severe neuropathic pain when you use a higher duration of the treatment of ketamine with higher doses. And maintenance is, of course, required, so you need to have some sort of follow-through ketamine maintenance therapies. I mentioned already dextromethorphan being helpful, and of course, monitoring for appropriate use is very helpful. And one of the things that Nova Health has found really helpful is, of course, the home use of intranasal and oral ketamine preparations to help out with neuropathic pain in the home front.